got a great pleasure and honor to welcome all of you, dear colleagues from all over the world, to the first Juvaluk and Lenizna International Academy, Julia 2022. I would like to thank you, beautyeurope.eu, the European distributor of Lenizna and Juvaluk, for creating an idea and being an initiator of this academy. I would like to give many thanks to Vime Global Company for creating those incredible products based on poly-D-lactic acid, Lenizna and Juvaluk, and for perfect organization of the great academy. Without your knowledge and experience, it would be impossible to meet so many noble guests today. Before we will go to the first topic, I would like to remind you, dear colleagues, that you can ask questions during the webinar by clicking the question and answers button at the bottom. After each lecture, I will choose some questions and read them. The speakers will answer them after each session. Thank you very much once again. Now, I've got a great pleasure to present Dr. Hosun Choi from Korea. He's a key doctor for many aesthetic products. He has had a lot of workshops and webinars for Juvaluk and Lenizna, not only in Korea, but also in Asian countries. He teaches beginner doctors to try Juvaluk and Lenizna with easier procedure techniques. Dr. Choi will talk about the latest aesthetic market trends because he's sensitive to the market trends. He works in Gangnam area of Korea, which is the most competitive aesthetic place in the world, and he has many relationships with international doctors. He will introduce poly-D-lactic acid, Juvaluk and Lenizna, and we will look at how to manage when we have some nodules after procedures. Dr. Choi, the floor is yours.
Thank you, Dr. Bartek. Hello, good morning or good evening. I'm Dr. Hosun Choi from South Korea. It's really nice to meet you online. And I would like to thank Vime Global for inviting me as a speaker to this great event. Today, I'm going to talk about overall clinical use of Juvaluk and Lenizna and how to manage complications too. First, I will share my slide. Okay, can you see my slide?
Yes,
good.
Perfect.
So let's get started. My topic is understanding of PD-LLA and introduction of Juvaluk and Lenizna with complication management. Okay. The new wave of medical aesthetics is focusing more on gracefully aging, well-aging, and prejuvenation rather than rejuvenation, and skin quality improvement rather than facial contouring. As we all know, collagen in our skin gradually decreases with age. Eventually, the density of skin collagen decreases, resulting in skin sagging and wrinkles on the skin. There are several ways to regenerate collagen in our skin. First, we can use cosmetics or take collagen supplements, or a more active way is induce wound healing process through energy-based devices or mesoneedling. However, the most effective way to regenerate collagen is to induce foreign body reactions using polymer injections, especially biocompatible synthetic polymers. During inducing foreign body reactions and activating wound healing process by synthetic polymers, overall skin improvements such as wrinkle improvement, skin elasticity increase, and skin tone increase can be achieved. The medical aesthetic market for skin firming and tightening is expanding gradually along with the recent trend of pursuing natural anti-aging treatment outcomes. Unlike fillers that simply restore volumes, biocompatible synthetic polymers such as PDLLA, today's topic, can cover the entire process from volume replacement to skin rejuvenation. Now, let's look into what PDLLA is. PDLLA is a type of biocompatible, biodegradable synthetic polymers. These polymers are already used in many forms of eco-friendly materials around us. PDLLA is one of the isomers of the PLA group that has 4 different types of isomers. Among them, L form and D form are widely used for biomedical applications. There is a visible difference between raw materials made of PLLA and PDLLA. As you see in these 2 figures, the former gives a rough and hard touch, while the latter, PDLLA, gives a fine and soft touch. PLLA particles are crystal shaped, so the surrounding tissue become highly acidic while they are hydrolyzed, resulting in a more intense inflammatory reactions. However, PDLLA particles are spherical and foamy shaped, so they degrade from the inside to outside, resulting in less acidic changes or less inflammatory reactions in the surrounding tissue. And the degradation time is a little shorter than PLLA particles. So it can be expected that PDLLA would be much more suitable for intradermal injections. According to an article published in 2001, when PDLLA particles are injected into the skin tissue, giant cells are observed until 7 to 8 months after injection. But after about a year, a giant cell is no longer observed. As you see on the right, this histologic finding with mesenteric stain shows a marked increase in collagen fibers, which are stained in violet color, purple color. It's 6 months after PDLLA was injected into the dermis. Now I'm going to introduce 2 types of products made of PDLLA powder. Actually, they are my favorite treatment modalities recently. Juveluc and Lenisna. Juveluc has less concentration of PDLLA and smaller particle size than Lenisna. Juveluc is for intradermal injection, and Lenisna is for subdermal or subcutaneous fat layer injection. There's one thing to check at this point. What are the ideal conditions of biostimulating polymers for intradermal use? They need to be highly biocompatible, and the outer shape should be smooth and spherical, and the inside has to show a foamy shape. And most importantly, the diameter of particles should not exceed 50 micrometers. These conditions correspond with those of Juveluc. These figures are 6 months after Juveluc was injected into the dermis. The histologic finding shows significant reduction in number of olive particles. Currently, fillers made of 4 types of synthetic polymers are available in the aesthetic market, and I'm using all of them currently. PCL has relatively the weakest resistance to heat, while PLLA and PDLLA show relatively strong resistance to heat. PDO degrades the most quickly before 6 months, And although PDLLA and PDO do not have a powerful volumizing effect, they have a better safety profile from much less risk of nodules formation, allowing intradermal injections. However, a PDLLA can provide some volume effect compared to PDO, but a little less effective, volume effect than compared to PLLA. Now let's take a look at the clinical use of Lenisna and Juveluc. Juveluc provides a powerful dermal remodeling effect, while Lenisna provides a natural volumizing and skin lifting or tightening effect. The common effect of the two is skin firming. So combining both products at once, a total 3D facial rejuvenation can be achieved. The recommended dilution method for Juveluc is to dilute 6 ml of normal saline. Actually, it's my personal dilution method, but I believe that this method is most widely used recently. So after diluting reconstitution of 6 ml of normal saline, we should wait until 1 day, at least 1 day, at least 2 hours, but we should shake well. In less than 2 hours, there could be some particles aggregation. So it's very important to set an incubation time, about 1 day. And before use, I shake more using a vortex mixer. And I take 2 ml out of 6 ml for 1 treatment session, and then mix 2 ml of non-cross-linked HA. When treating skin pores, mixing with botulinum toxin will be helpful, of course. When injecting the mixture intradermally, I use a multi-needle injector or manual injection with 30G needle with 4 mm length, or both methods at the same time. And a laser pressure-based microjet device could be also a good drug delivery modality. It is important to repeat 3 treatment sessions at 4 weeks intervals for the initial treatment in order to get prolonged effect by the accumulation of collagen in the dermis. This protocol is about Juveluc. And for maintenance treatments, repeat another treatment session every 3 to 6 months. For Lenisna, it is recommended to dilute with 8 ml of normal saline, preferably 1 day of incubation time. After vortex shaking, a small amount of lidocaine is generally mixed, and if necessary, 1 to 2 ml of soft HA filler, soft cross-linked HA filler can be mixed to compensate or enhance a weak volumizing effect of Lenisna, but it's optional, not always. And when mixing Lenisna emulsion with the cross-linked HA filler, you should use back and forth method, at least 30 times of back and forth passages, to make sure that the viscous solution and less viscous solution is mixed well, evenly mixed. When injecting Lenisna, I prefer to use 22G cannula into subdermal plane. In order to distribute the solution evenly, a sufficient dissection using fanning or cross-hatching technique is necessary during the injection. Don't forget a gentle massage right after injection, but additional post-treatment massage for 5 days is not necessary. Since Lenisna has a low risk of nodule formation, it can be applied to the entire face and neck except the lower lid area. Once Lenisna emulsion is injected into the subdermal plane, it provides effective dermal remodeling effect through a continuous dermal stimulation. So when I use Lenisna, I try to dissect more and but very gently and more evenly to make more mechanical stimulation during injection. These are entry point and usual, my personal amount of use for each part of the face. Yeah, you can just refer to it because the exact amount should be customized. So we need some guidelines, but in practice, we should use, depending on patients' requirements or patients' facial skin conditions. In general, I recommend, yes? Pardon?
Do we have any questions? If there are any questions, please click for question and answers, and then I will read all those questions after the lecture.
Okay, so I will continue, right?
Yes, please continue, of course.
Okay. So in general, I recommend my patients to get 2 treatment sessions at about 6 weeks intervals for the initial treatment. And I think 3rd treatment session is optional, not always, if required. To maintain good outcomes, it is advisable to repeat 1 or 2 treatment sessions every 6 months. So the 6 months of interval is quite important because if you put too much particles into the skin, they will be accumulated too much. So especially when using Lenisna, after achieving good outcomes and only to maintaining the results, then just wait until 6 months and then re-inject. 1 month after dilution stored at room temperature, the particle shape of Juvalup in Lenisna was relatively well maintained, but 3 months after dilution, a noticeable deformation in the shape of particles was observed. So it means that it's better to use them within 1 month after dilution, after reconstitution. So now I will show you a video about Juvalup injection using manual intradermal injection technique. So now I'm using 30G short needle with 4 mm length, and the target depth is about 1 to 1.5 mm from the skin surface. Actually, the exact depth should be different depending on the area of the face. So where the skin is quite thick, you can inject deeper than 1.5 mm, and the bolus injection amount will be a bit increased. This part, I'm targeting the pores and skin scars. So that's why I'm injecting a little bit deeper. Now I'm dissecting, I'm making a subcision technique using the needle. So before injection, subcision from multiple points, or you can do fanning technique as well. So after a small subcision and then you inject, then the effect will be much better. And the distance between 2 points may vary, but about 1 centimeter. And injection amount should not be too much. If you injected too much, then it's better to massage very strongly to prevent too visible lumps. This video is about contouring the upper and mid face using Lenisna. So now I'm checking the hills and valley. So where the facial contour has concavity, Then I check and I try to inject into this area. Forehead is one of very common indication area for Lenissna injection. And these days I inject more Lenissna than HA fillers in the forehead. So just like filler injections, entry points are, I'm using this medial eyebrow end point. Of course, there's some neurovascular bundles, such as supratrochlear arteries and nerves. But it's okay because I'm inserting very superficially and then I go deeper. However, when I use Lenissna, I use into multiple layer, not only deep layer. Subdermal plane is also available. So it's rather than focusing on the depths, you should focus on even injections. So take enough time to inject, but smaller volume per threading. And after injection, I use a dry gauze to make even distribution. And for temple, if the temple depression is quite severe, then I would inject HA filler into deep layer just above the bone. And then I use Lenissna into interfascial layer, which is between superficial and deep temporal fascia. So between these two fascias, as we all know that the tissue is quite loose, so the solution will be easily spread. And for the cheek, just like filler injection, you can use by fanning or cross-hatching technique. And from the lower part, you can also approach deep layer. I'm targeting now medial SUF. Of course, infraorbital area is not a very recommended area, but if you keep the layer deep, always deep, it's okay. And inject very small volume. And for nasolabial fold, multiple layers are used, or just like temple areas, you can use HA filler into deep layer in combination. And now I'm fixing the accordion line. The accordion line are quite difficult to correct, by HA filler, but using Lenissna, you can easily correct, but I approach perpendicularly to the line to make perpendicular collagen columns to the accordion lines. Then the lines will be much more improved. So this is immediate after injection. You are seeing that the cheek are swollen, but after 2 or 3 days, the solution will be decreased. And depending on the area and purpose of treatment, a combination treatment is commonly performed with the following treatment modalities. Among them, most clinicians they agree that RF devices seem to be the best match, the best coupling with Lenissna or Juvelup, especially when performed after PDLA injection. In addition, botulinum toxin and HA filler are also very commonly used as a combined or cocktail treatment. So let's talk about briefly about the side effect. These pictures showing nodules formations after injection. Intradermal large bolus injection to very thin skin may result in lumps formation. Yes, but in the case of lumps found immediately after injection, you can be easily resolved by strong massage. If it's not necessary, and the nodules last over time, it can be relieved by using needle RF with stacking method. A little bit strong power. However, even without any treatment, in most cases, lumps or nodules rarely last more than 3 to 4 months. So it's just temporary and you don't need to worry about it. But as other treatments, it's better to prevent these problems, adverse events, by enough dilution and enough incubation time, and do not inject too superficially large bolus amount. And for lower lid or neck skin, usually the skin is quite thin, so it's better to use multi-needle injector, or I would recommend to use Lenisna intra subcutaneous fat layer. So intradermal injection should be very carefully done in these areas. However, sometimes, but very rarely, there may be an allergic reaction by a solution mix, maybe together, or metal components of the needle may cause some allergic reaction. But these allergic reactions are much more influenced by intrinsic factors. The patient's medical history, medical records should be examined. But anyway, these kind of adverse events are very rare. But if you see this effect or these outcomes, then I would recommend to inject triamcinolone intralesional injection and oral prednisolone or doxycycline, or together at least 2 weeks, if necessary, more than 1 month required. I'll show you a few patients before and after, before wrapping my lecture. Okay, she had very rough texture over the face, but after Juvelu treatment, you can see that her face has a lot smoother texture and less wrinkles. Of course, Juvelu is quite good for skin scar treatments. Of course, when combined with fractional laser, you can achieve better results. And Lenisna can create very smooth and natural augmentation of forehead or other areas of face. So if patients don't want HA filler injection, or they already failed in previous treatments, then I would strongly recommend Lenisna. And for all patients with skin laxity, Lenisna can create not only optimal volume, but also skin firming and tightening at the same time. So it's quite beneficial for these patients. And even not to all patients, some patients have skin sagging and skin thinning, or loose skin, then just use Lenisna. And for the neck, if a patient has only a skin texture, want to improve the skin texture, you can use Juvelu only. Or patients with skin laxity, neck skin laxity, I would recommend to use Lenisna and Juvelu in combination at the same time. This is my conclusion. Clinically, the biggest advantage of PDLLA emulsion is that despite being a beginner for these injectables, safe, successful procedures could be done, available through this treatment, and effective skin tightening and volumizing control can be achieved in a very natural way. In addition, various dilution ratios can be applied according to the purpose of treatment. It's just like there are many kinds of coffee types on the menu of the coffee shop, and we can choose the taste of coffee we want. Similarly, Lenisna and Juvelu can be tuned through various dilution ratios, which allow a wide range of clinical applications depending on the purpose of treatment, such as facial volume replacement, skin laxity correction, skin scar and pore improvement, and general anti-aging skin rejuvenation as well. So when both skin rejuvenation and volume replacement are required, then PDLLA emulsion could be a wonderful choice. Okay, that's it for my presentation today. Thank you for watching my presentation.
Thank you, Dr. Cho, for a great lecture. Thank you very much. We've got a few questions. First one, I think is quite simple. What is the NS when you dilute initially Lenista? I think that I could even give the answer. It's normal saline, Dr. Contreras. It's normal saline. It's solution 0.9% of chloride natrium. The second question is for Dr. Che. Should we do aspiration before injection to be sure that we didn't hit the blood vessel?
Yes, normally aspiration is necessary, but the question means Lenista, right? So, but since I'm using quite thick cannula, 22G cannula, actually it's very hard to inject intravascularly. So almost 0%, zero possibility of intravascular injection. But why not aspiration? So anytime we should be more careful. So aspiration is recommended, but not absolutely necessary.
Another question, what is the procedure in case of complication as HA, hyaluronic acid? I think that doctor meant that if we mix cross-linked hyaluronic acid with Lenista, what is the procedure? And should we use hyalase to dissolve it?
Yes, in case of complications, but also I think it's a question about Lenista, right? Because when using Lenista, I sometimes use cross-linked HA. So if you want to lessen volume, you can use hyaluronidase, but since I'm using only 1 to 2 ml for 8 ml of Lenista, so it would be 10 to 20% only. So this very small portion of HA filler, if you get rid of this filler portion, may provide very small way of treatment, maybe. So I think the only complication is not enough volumizing, no. So you only have to do one more session.
There's also one very interesting paper about the diameter of the microspheres. Mm-hmm. If they are less than 50 or 60 microns, they usually pass through the capillary vessels. So there is very high probability if you even inject the Lenista into bloodstream, the shear force of bloodstream will immediately dilute the Lenista. So those spheres will pass through the arteries without clogging them, like in cross-linked hyaluronic acid. So the safety of Lenista is far better than classic approach to volumizing, phase volumization, like using hyaluronic acid. Another question is from Dr. Maya Abbas. Some doctors advocate the exclusive use of needles. It's very interesting concept of very brave. Use only needles instead of cannulas. How to adapt injections to only needles injectors? Yes, such very interesting question.
Yeah, it's also a question about Lenista, right? Yes. I think there are some pros and cons. Using needle, you can inject the solution into very precise depths, layer plane, that is immediate subdermal plane or even deep dermal plane. So I think the needle can provide this very precise injection. However, for beginners, I wouldn't recommend needle because you may cause some bleeding and bruising. And since Lenista has a relatively higher size of particles, so using a very thin needle, you couldn't inject naturally. So you should use 21G or at least 23G needle. then it would be very aggressive, I think. So
Very traumatic for patients, yes.
yeah, so the
Another thing
guideline
is
is cannula.
that if you ask the worldwide known specialists for safety of injections, for example, Denis Demiryak from Turkey or Dr. Redka Svoboda from Europe, they insist to use cannulas. The more you use cannulas, the safer you are. So cannula is the basic technique for using a classic approach. I mean, hyaluronic acid, cross-linked hyaluronic acid, or Lenista. Needle is rather preferable for Juvaluk or mesotherapies, not for classic approach for volumization. Cannula is far more safe for us.
Totally agree with you.
Is how do Juvaluk or Lenista compare in terms of safety in case of vascular incidents? I think that we have spoken about that. Please, could you clarify or explain more about mixing process with hyaluronic acid non-cross-linked in case of Juvaluk and cross-linked in case of Lenista, and a soft filler? Any preference about soft fillers?
Soft fillers, I'm using not a specific soft filler. So any soft filler you are using in your clinic.
Low level of cross linkage.
That's right. Yes. Yeah. Any soft filler. Yes.
Okay. Any insights about vascular complication? It was especially on forehead or glabella. So I think that we have spoken already about the vascular complications. What is the protocol for radiofrequency and Lenista? Would you what would be time distance between those treatments?
Maybe I already mentioned about it, so maybe I can share my protocols and my dilution method later on, because
maybe subject in next meeting.
Yeah,
this would be very interesting because I also use radio frequency combined with collagen stimulation. It's very interesting protocol for our patient. How many milliliters of Juvaluk is recommended for neck area?
Neck area, yes. I think, yeah, almost the same amount as full face I'm using, but a little bit requires a little bit less amount. But when covering the jawline, yeah, almost similar. So I use 2 syringes. I mean, 2 of 6 and another 2 of 6. So to cover full face and the neck.
All right. So there's another question, but I think that it's some kind of introduction of my my next lecture. Could you please recommend the use of Juvaluk for periorbital rejuvenation? If yes, protocol, please. So I think that it's some kind of introduction of my lecture. Thank you, Dr. Adam Scherer. So I think that it's time to thank you very much, Dr. Che, for your great lecture and all the answers. And it's time for me to present myself.
Excuse me, I'm seeing another question from Dr. So, or what is gold stick in video? The gold stick is a vibrator. It's very cheap. Yeah, it's to reduce the pain, and the patient will be more convenient during injection. It's quite effective.
Yes. All right. So, Dr. Che, thank you very much.
You're welcome.
To listen to your lecture.
Thank you very much.
So it's now time for introduce myself. I think I could share my second, please. Where am I? Okay, here. I will share. Okay. My name is Bartłomiej Sobolewski, and I am a medical director in Europe, in Poland. I am also CEO and owner of Laboratorium Piękna in Polish. It's in English Beauty Lab. It's a aesthetic medicine clinic in Poland. And in my everyday practice, I focus on introduction and development of the most modern technologies to get great results with maximum safety for our patients. The safety is the highest priority in my everyday practice. And together with Beauty Europe, I have introduced Lenysna and Juvaluc to the European market. It was about 2 years ago. And since then, I think that there is no better procedure for many different indications. I have a great pleasure to present you Juvaluc procedures for eyelid and face rejuvenation, or for TEDRO and lower eyelid rejuvenation. I will present you my considerations on how to achieve maximum safety and to avoid nodules formation. So, of course, the Juvaluc indications are filling of skin cavities to restore volume of soft tissues, and is recommended also to sorry, I have to close one window. Excuse me, I have to go back. It is recommended to be used for rebuild of any morphological asymmetries for face as well, or other body areas. And very important, the Juvaluc is perfect for skin collagen stimulation as a mesotherapy procedure for our patients. So the indications are TEDRO filling, lower eyelid collagen stimulation or lower eyelid rejuvenation, skin revitalization in face, neck, and décolleté areas as a mesotherapy, reduction of enlarged skin pores, and also a very interesting indication to reduce acne scars, usually in combination with fractional procedures, radiofrequency, microneedling, or ablasive CO2, for example, fractional lasers. The protocol which I use in everyday practice is the dilution with sterile distilled water mixed with lidocaine. There is very interesting paper on the strategy of dilution of L-Lactic acid preparation, and the sterile water is slightly better than normal saline. The normal saline is in my clinic used only in case of local anesthetic allergies. It's very rare circumstance, so we mainly dilute the Juvaluc with 3 ml of water, sterile distilled water for injections, and 1 ml of lidocaine, usually 2%, to prepare already ready preparation for the injection. And we use both 32 or 30G needle in needle injections, and 25 or even 27G cannula for eyelid area. Of course, we use that what I mentioned before, 3 ml of water plus 1 ml of lidocaine. We use Vortex, and there is no other way to safely and quickly prepare this solution. You need this special device, this Vortex, to prepare Lenysna and Juvaluc. Then we use, or I use 1 ml of that solution, prepared solution, after 30 minutes of shaking, to lower eyelid area for both sides. So half ml of Juvaluc for one side and half ml for another side, and 3 ml. Another part of this preparation is used as a mesotherapy, because I use mesogun or vital injector. It's already mechanical device for injections. It gives you more control of the layer or the depth of the injections, and you can use less amount of Juvaluc per one injection. It seems to be also a way to avoid formation of nodules. We can use it safely, or we can unused preparations store for 7 to 72 hours in the refrigerator. But we know that we can even wait up to 1 month. After 1 month, as my previous lecture referred, but after 1 month, the formation of those spheres is decreased, and they are losing their structure. After removing from the fridge, you should set it at room temperature for about 15 minutes, and then stir it or mix it with Vortex for 5 minutes. We do not use cold preparation. It's quite uncomfortable for the patient to bear it, to inject cold solution. Juveluc is designed to inject deeply intradermally or subcutaneously. The subcutaneous tissue is usually the area we use it in subcutaneous tissue is lower eyelid and teardrow area. We know that we cannot use Lenista in this area because it's too strong collagen stimulator to safely perform injections in lower eyelid and teardrow area. But Juveluc seems to be perfect for this correction of deep teardrows and the rejuvenation of skin of lower eyelid. There were many questions about how we can perform this because we know after experiences, many years of experiences after using of Sculptra that there is very risky area to very prone to form nodules. But if we use the already tested procedure, I will show you in a few minutes this procedure, there is really very high level of safety to use Juveluc as a collagen stimulator and some kind of dermal filler in the teardrow area and lower eyelid area. I usually advise my patients to undergo 2 or 3 procedures every 3 months. The European market is maybe a little bit different than the Korean market. And we advise to use, to do longer gaps between procedures. So 2 or 3 procedures every 3 months. Juveluc and Lenista are a perfect combination. So they could and should be combined together. We treat patients with a volumetric preparation, which is Lenista, and is designed to rebuild deep face volume and to stimulate native collagen. Juveluc is less concentrated preparation, and we inject it directly to the skin, to the subcutaneous tissue or intradermally very deep, and in the lower eyelid area. So we can combine those 2 procedures to get those full face rejuvenations, both the volumization of the zygomatic area and nasolabial folds, filling volumization of meridian line area, and teardrow filling and lower eyelid skin armoring with Juveluc. So we also combine them in the same manner, I mean 2 or 3 procedures every 3 months. The injection technique in the lower eyelid area is up to every injector. Every doctor has its own experiences and its own way to avoid complications in this area. But I don't know if you can see my, no, I think that there is no pointer. The left strategy, I mean, the lowest point of injection is my favorite, and I use it for teardrow filling or teardrow volumization with Juveluc, and the lateral injection or entry point is for lower eyelid area. I will show you in a while on a short film how to do this procedure. So we use 0.2 milliliter in a retrograde linear technique with cannula, just in the line of teardrow. Then we use 0.3 milliliter of Juveluc with fanning technique with this lateral entry point in the lower eyelid to do the even distribution of Juveluc solution just in the subcutaneous tissue. It's very important to remember that this is the only area of our face or the subcutaneous tissue where there is no present subcutaneous fat tissue. The fat tissue is intraorbitally under the muscle and the fascia. Under the skin, there is no visible or preparable fat tissue. So we just inject in the subcutaneous tissue. There is some kind of loose, very thin layer of loose fibrotic tissue connecting the skin with muscle, orbicularis muscle, oculi muscle. So 0.3 milliliter for each side for lower eyelid area. And then the left 3 milliliters of the solution, I put it into the vital injector and perform deep intradermal injections usually by a vital injector or any kind of mesogun, on the depth of 1.6 to 2 millimeters. It depends on the thickness of the skin. Man or male skin is thicker and even sometimes deeper than 2.2, 2.4 millimeters is chosen by me on the vital injector. Boluses 15 to 20 microliters per one bolus. It usually, those devices have those cartridges with 5 or 9 needles. So it's about 2 to 3 microliters per one needle in this cartridge. If we perform those injections by hand, I advise to inject at least at 1.6 millimeter deeply intradermally to avoid formulation of nodules and not so big deposits. So small deposits with quite deep injections. For full face rejuvenation, usually with 3 milliliters of Juvaluc put into the injector, I can easily perform the procedure for full face rejuvenation and neck rejuvenation. So there is very interesting proposal for patients and an offer. We do 3 procedures at once. First part of the procedure is Terdro filling and lower eyelid rejuvenation. The second part of this procedure is full face rejuvenation, collagen stimulation in the skin of the face. And the third part of this procedure is skin rejuvenation of the neck. So every area is performed with vital injector. Now I will present you our strategy. So I collect or withdraw 1 ml for this 1 milliliter syringe, and this is the amount of Juvaluc used for both sides of lower eyelid area. I mean both Terdro and lower eyelid per se. 3 milliliters is put into the mesogun, whatever you like. There are many devices in the world available right now. The entry point is in line of Terdro with 27G cannula. This film is a little bit older strategy. 0.1 was injected subcutaneously and 0.1 under the orbicularis muscle. But now I have resigned from this second bolus, I mean 0.1 under the muscle. I inject 0.2 milliliter just in the subcutaneous tissue. It's more safe, more comfortable for the patient because crossing the muscle with cannula is quite uncomfortable. So altogether 0.5 milliliter per one side for the eye rejuvenation, and the injections with injector with the mesogun for the full face. It's very effective, very comfortable for the patient. Of course, we use topical anesthesia. It's usually 20% of lidocaine. Please spot the level of or the depth of the injection. Those injections are just under the thin skin of lower eyelid, just in the subcutaneous tissue. It's another patient with this new approach. I mean 0.2 milliliter in the Terdro area and 0.3 with a fanning technique in the lower eyelid area. If you are not sure if you are on the proper layer, just lift a little bit the cannula and you should see this small amount of skin or a very thin skin just under the just over the cannula. If so, you are sure and you are safe that you are in the proper layer. Sorry. Now we will discuss some precautions and some considerations about the safety. While withdrawing the cannula, we advise our doctors when we train them to stop injecting Juvaluc with cannula 1 centimeter before the entry point and before removing the cannula from the subcutaneous tissue, because there is a risk of making a small deposit just in the entry point. And this is one of the reasons why we observe nodules after the using of cannula in the lower eyelid area. Another precaution is to, or advice is to make a gentle massage to evenly distribute preparation in the subcutaneous tissue, especially if we perform the injections in the lower eyelid area. And another very important point is that the message made by patient at home is completely unnecessary in case of Juvaluc in Lenisna, comparing to, for example, to polylactic acid, L-lactic acid compositions like Sculptra. We in Europe, we are very aware of complications when mixing or combining two different collagen stimulators. So the official recommendations in Europe are to keep those intervals between different type of collagen stimulators for full face rejuvenation. If patient decided in past to use polycarbonolactone or calcium hydroxyapatite, we advise to wait at least 12 months after calcium hydroxyapatite and 24 months after polycarbonolactone injections to minimize the risk of hyperstimulation, collagen hyperstimulation. But we try and we use the combination of polylactic DL polylactic acid with Aptos threads. They are composed of polylactic acid and polycarbonolactone, but usually we choose different layers of injections. We implement threads in the subcutaneous tissue, and in case of Lenisna and the combination with barbed threads with polylactic acid and caprolactone, we inject Lenisna deeper in the supraperiosteum for full face volumization. These are my considerations about the comparison of poly-D-lactic acid and polycarbonolactone and hydroxyapatite. Some kind of not medical, but the way of marketing, how to sell or convince our patients to use poly-D-lactic acid instead of polycarbonolactone or hydroxyapatite. Hydroxyapatite is the shortest collagen stimulator. I mean, it's the most prone to fast hydrolysis. And the package of the volume of the product is 1.5 or 1.25 milliliter, and it's quite expensive comparing to Lenisna. Polycarbonolactone is in 1 milliliter vials, and the duration of effect, if we compare polycarbonolactone hydroxyapatite and poly-D-lactic acid and polylactic acid, there are many clinical observations that the effect lasts for the longest period of time after polylactic acids, generally speaking. And very important thing is that we have very interesting offer for our patients is Juvaluc for lower eyelid area and teardrow rejuvenation. And we also remember about body procedures for Lenisna injections. Now I will show you some of the results. This was the first patient in Poland and in Europe. Sorry for the quality of the first picture. This is another patient before and after 2 months of one procedure of Juvaluc. We can spot a perfect volumization of teardrow and the skin tightening of lower eyelid. This is another patient. There was no botulinum toxin used in this case, and there is a very strong decrease of those very gentle little wrinkles after Lenisna, only after one procedure of Juvaluc. Sorry, Juvaluc, not Lenisna. The same patient. This is one of my workers. She had only one procedure with Juvaluc, with this protocol I have showed you. And there is one very interesting thing. We observed a slight decrease of hyperpigmentation after Juvaluc. Also, not only the volumization of the teardrop, but also the decrease of amount of those hyperpigmentation. This is one of the most spectacular patients with very deep, typical in Poland, very deep teardrop. And this is patient after, I think, 3 or 4 months after one procedure of Juvaluk, just before the second procedure. She's very happy with the results of collagen stimulation in the lower eyelid. Another patient with very similar, very deep teardrop. It's very typical in Europe. I think that there is a very interesting topic. I've got the pleasure to hear this lecture on Colchida on Aptos conference, that there are very crucial differences between different parts of the world, and the aesthetic medicine looks different in Europe, looks different in Far East, and looks different in, for example, South America, due to different anatomical problems of our patients. Another patient, young lady with also a very deep teardrop and very satisfactory effect. My friend, Dr. Ewa Rybicka, one procedure of mesotherapy of neck, 5 milliliters of Juvaluk injected, I think with needle by hand, with such spectacular effect. Very difficult to manage such very floppy, very difficult to rejuvenate skin of neck. Another doctor from Poland with his effects, Dr. Michael, showed us some satisfactory effects after one procedure of Juvaluk. Another patient, another one. The teardrop area is very common in Poland. This is very popular problem that we have to manage, and there was no reasonable or safe procedure until Juvaluk. Hyaluronic acid in this area is very risky. There is high risk of migration of the deposit of hyaluronic acid after many years. There is a risk of edema in this area after injection cross-linked hyaluronic acid. So the only alternative is like fat transfer. But we know it's very safe, very comfortable to inject with very nice effects, but not so many patients will undergo liposuction to do the teardrop filling with fat tissue. Another patient with teardrop and hyperpigmentation in this area, we can also spot the lower grade hyperpigmentation after the procedure. Some adverse events we have spotted. We have performed 3,500 procedures in Poland since June 2021. 90% of all Juvaluk treatments was performed also in the lower eyelid. So it's very, very common procedure in this area in Poland. Only 11 reported nodules as adverse events, because I asked all my sales representatives to get the information about adverse events after the procedures. So there is 0.31% of complication rate in the lower eyelid area in manner of nodule formation. Main causes after the analysis of these cases we have observed in Poland, that main causes of nodule formation is use of needle in eyelid area, because there were some doctors trying to use a needle injection. As previous lecturer, Dr. Chair, spotted that if you use needle, you can easily lose the layer control. Use of cannula gives you the easiest way to control the layer you are working with. So if you use needle, you can easily do the too superficial injection, especially in the lower eyelid area when the skin is very thin. So the use of needle and too superficial injection can be caused by the use of needle. And another point is not following the procedures. Usually it was the problem of too much volume, too superficially, and too often. And there is very interesting case, female 45 years old, symptoms edema of lower eyelid. She came to my clinic to undergo a consultation because there was a problem after Givaluk injections. After obtaining a medical history, there was no serious comorbidities. On January 2022, there was a radiesse hydroxyapatite injection to terminal area, completely with no reason. I don't know what was the idea of such injection. And then April 2022, after 3 or 4 months, the first Givaluk, 1.5 milliliter per side, interjaw and lower eyelid with needle. And after 1 month, again, second Givaluk procedure with 1.5 milliliter per one side, interjaw area and lower eyelid. So the symptoms, fortunately, was only the edema of lower eyelid. The treatment was very effective with oral steroids, and if it wouldn't help, the only strategy is to use collagenase locally in this area after the combination of those two different collagen stimulators in this very risky area. The reason why I didn't decide to use locally injected steroids was that there was no palpable nodules after the Givaluk. Another case, it was my patient, a female, 43 years old. The symptoms were palpable deposits after Lenista injections in nasolabial folds, marionette lines, and neck. And the medical history, there was rheumatoid arthritis. This patient suffers from rheumatoid arthritis, of course, in remission with biological treatment. But this was the first case when I had to use local steroid injections. I usually use betamethasone dipropionate. It's Diprofos in Europe. I usually mix 0.7 milliliter of betamethasone with 0.3 milliliter of lidocaine, and then I use 32G needle, and I precisely inject this solution straight into deposits, into these nodules. Sometimes I use ultrasound guidance if there are deeper deposits or deeper nodules, just to inject a very small amount of long-lasting steroid straight to the nodule. After 2 sessions, all the palpable deposits decreased in a very satisfactory manner. So patient is very happy after this treatment. And some take-home messages after all the considerations and experiences of using Lenista and Givaluk. Givaluk is very effective and optimal treatment for teardrop area. Givaluk is very safe for teardrop because we haven't spotted nodules in this area, except some single cases of nodules in the entry point. So that's why we should stop injecting 1 centimeter before removing the cannula from the subcutaneous tissue. Givaluk is very effective in lower eyelid rejuvenation, is very effective in full face skin rejuvenation, is very easy to prepare and use, and is very effective and profitable treatment for your clinics. Remember to take a medical history of the patient, especially to avoid patients with autoimmune diseases, because there is a higher risk of overstimulation of collagen production in these groups of patients. I think it would be very interesting subject for the next Julia meeting. Follow the procedure. If you follow the procedure, it's tested. We've done many thousands of patients with this procedure, and we know it's fully safe for the doctor and for the patient. Avoid too superficial injections. Use cannula in eyelid area. Don't try to use needle in this area, and keep recommended intervals. Too short intervals may cause also hyperstimulation of collagen. And the treatment of nodules, the first and the safest procedure is to inject saline, normal saline, straight into the nodule, especially for the beginners. Use 32G needle, typical needle from mesotherapy, and inject saline just straight into the nodule. If you are experienced with autologous procedures and you have IPRF sets in your clinic, you can use IPRF injections also straight to the nodules. If it won't help, another step is to inject steroids locally, just straight into the nodule. If it won't help, we advise to use steroids orally. And with some problems, technical problems and formal problems, the use of collagenase is not so common in the world yet, but I think it's one of the best strategies for recovering from nodules formation. Thank you very much. Okay, I have to. Okay. To go back to Zoom. All right. Sorry. Where is my? Okay. So now I have a great pleasure. Sorry, I have to look for questions. There is a question about experience on upper eyelid rejuvenation. The point is that the best strategy for upper eyelid, because there is another kind of problems, usually the loose skin, and we need to remove this part of the skin. So the blepharoplasty is the first strategy for upper eyelid. Of course, you can use Juvelook also with cannula to rejuvenate the skin, especially after the procedures of surgical correction. Okay, I have to. Oh, yes, we are back. Do you have any experience to mix Juvelook with hyaluronic acid? No, not yet. Dr. Hosung Che is very great inspiration for me to start combining those two substances together. So I think that since today, I will mix them together. Now, I have a great pleasure to present Dr. Eugene Kim from Korea. She's a celebrity in Korean Dermatology Society. She's a YouTuber and she's being on various TV broadcasts in Korea. She was a key opinion leader for Sculptra before, but now she has become a Juvelook lover. Dr. Kim will look at her Juvelook cases for atrophic scars and stretch marks. And generally, these cases have been treated with lasers, but the results are not dramatic. Juvelook makes some difference, and we can wear a bikini with more confidence. Dr. Kim, the floor is yours. We cannot hear you.
다시.
Okay. Yes. Now we can.
Good morning. My name is Yeonjin Kim. I'm a dermatologist in Korea. I'm currently visiting New York City, which our second dermatology office is opening soon. This is my partner, Dr. Hee-jin Kim, who will run the office. Actually, she is my sister as well, and she will help me today for the presentation. Slide. I'm the owner of Purine Dermatology Clinic and YouTuber. Please subscribe to my channel and you can get various tips on skincare in my channel. Soon, English subtitle will be added. I have been using PLA product for a long time because many of my patients want a natural change. I had been using Sculptra for almost 10 years before Juvelook came out. And after Juvelook was launched, I have only been using Juvelook among PLA products. Juvelook is able to create more customers by not only replacing Sculptra or HA fillers, but also providing solutions to indications that were difficult to treat, such as stretch marks. As a result, for almost about 2 years, I have been able to use nearly 1,000 vials of Juvelook. Why do I prefer Juvelook so much? There are many reasons, but these 3 are the main reasons to use Juvelook. The first is a variety of indications. I started using Juvelook mainly for fine wrinkles and nasolabial fold. And recently, I have been using Juvelook for skin rejuvenation, acne scars, and stretch mark. Juvelook has recently been called the skin solution in Korea because Juvelook can resolve many skin concerns. The second is safety. In fact, while using Sculptra, I had a few granulomas. Thus, I decided not to use anymore. There are minimal side effects while using Juvelook, and nodules sometimes occur, but the nodules are not related to tissue change. They can disappear quickly with thermal treatment or strong massage. Third, it is a natural treatment result. Since there is no downtime after the procedure, patients can get back to their daily life immediately. The effect is natural, so it is preferred procedure for those who don't want to be caught having aesthetic procedures by others. 80% of the world's 11 to 30-year-old suffers from acne, and 1 in 5 of them have acne scars. In this case, atrophic scars and hypertrophic scars may occur. Most of the acne scar patients I met had atrophic scars, and recently I treat atrophic scar with Juvelook. Before using Juvelook, acne scars were mainly treated using laser or RF. In this case, the skin barrier was damaged and the skin became more sensitive. And it was also necessary to recover the wound on the skin after laser treatment. However, when using Juvelook, there is no need to worry about this. And I have seen that not only the scar get better, but the overall quality of skin improved also. Next, let's look at the stretch mark. Stretch marks are atrophic linear banded lesions that appear on the skin in the area damaged by pulling force. Histologically, the epidermis is atrophied, and in the dermis, collagen fibers are seen and rearranged parallel to the skin. Most often, it can occur when the skin stretches quickly. such as during pregnancy or rapid weight gain. Early stretch marks appear as red lines and bands on the skin, which is called stria rubra. The purple striatum gradually turns white over time and becomes less pronounced, wrinkled, and atrophied, which is called stria alba. How can we treat stretch marks so that we can regain patient confidence? Retinoic acid such as tretinoin or glycolic acid and TCA can be used for early stretch mark to have a peeling effect, and various lasers or RF treatment have been tried to treat stretch marks. But it is very rare that the atrophied skin recovers and doesn't have a dramatic effect. However, in recent years, stretch marks have been treated using Juverup, and collagen and elastin regeneration were seen after Juverup treatment. I would like to tell you the protocol to treat these atrophic scars and stretch mark. Reconstitution for acne scar treatment is usually using 6 cc normal saline, and sometimes 4 cc is used to inject deep and local scars. The amount of reconstitution may be slightly different depending on doctor's preference, so it can be fun to find your own recipe with Juvelup. Based on manual injection, I usually 0.1 cc per shot. And in order to see the effect, I recommend treatment at least 3 times. The injection depth is just under the scar, usually deep dermis layer. For deep scar, such as 2 millimeter or deeper, I prefer manual injection. For superficial scars such as 2 millimeter or less depths, I prefer using multi-needle injector or needle RF. In this case, Juvelup was injected 3 times at 4-week intervals. An injection was performed using multi-needle injector. You can see the effect of tightening of the skin pores as well as improving the skin of the atrophic scar area. In this case, I used a needle RF. First inject or apply the reconstituted Juvelup to the face and then shoot the needle RF there to penetrate Juvelup into the skin. If you use a needle RF, you can see the effect a little faster because of synergetic effect of RF heat with Juvelup. In this case, Juvelup was also injected using a needle RF, and you can see that not only the skin texture is improved, but also the skin quality is improved. The redness is treated and the skin tone is brightened. This case is a 15-year-old woman with deep scar. Juvelup was placed by manual injection, and you can see the scar fills up well and the border of the scar looks natural. I would like to tell you about the stretch mark treatment. I usually reconstitute Juvelup with 8 cc normal saline and inject 0.05 cc per shot just under the stretch mark. It is usually the upper dermis layer. It takes at least 5 treatments to be effective. But you can see good result that cannot seen in other treatment. Stretch mark can also be injected with various drug delivery stool. Some people inject Juveluc using a needle-free injector that can quickly inject into stretch mark in a wide area, precisely target under the stretch mark. This is my colleague's case who used needle-free injector called Mirajet. I usually treat stretch mark with manual injection. I inject about 0.05 cc per point and give a strong massage after the injection. I will share the photo of my cases by manual injection later. Some clinics changed treatment fee per vial, and some clinics charge a treatment fee in proportion to the area of stretch marks. The cases were conducted under the same protocol, and some strong collagen production ability of Juveluc allows high satisfaction for stretch marks treatment. It seems that Juveluc has various indications due to its excellent ability to regenerate collagen in the dermis. And above all, there are few side effects, so you can comfortably conduct the procedure, and the satisfaction of the patient is also excellent. So I think it has become #1 skin booster in Korea. That's all for today. Thank you for listening. If you have any question, please feel free to ask. Thank you.
Thank you, Dr. Eugene Kim. Great lecture, very interesting application of Juveluc. It shows us that this is one of the best products in the world right now to focus on different aspects of skin, not only in face rejuvenation, but also for different body problems. Do we have any questions? Hello world, do we have any questions? I think that this lecture was so perfect that everything was so clear that there is no questions. The better the lecturer, the less questions there are. So thank you, Dr. Kim, for perfect lecture.
Thank you.
Now it's time to present to you Dr. Inigo de Felipe from Spain.
Hello, Bartek. How are you doing? Well, I'm from Spain, but I'm lecturing from London, so it's not 4:30, it's 3:30. Yeah.
Great.
And as you can see, it's quite sunny, which is very strange here in London, right? It's sunny today. Yeah, and the temperature, I think, is 21 degrees Celsius. And here I have Marty, right, who's working with me, and we've just finished some clinics today, right? I'm very happy. I have to congratulate you for your presentation. I think you have an enormous experience. I mean, 3,510 vials, that's amazing. I mean, I've been injecting for a long time with working with different polylactic acid, but so many. I don't know whether the light is okay. Let me just put myself here. Is this okay? Okay. I'm going to share my screen so that let me see, how can I share this? Let me see.
Okay. I have to introduce you.
Oh yeah, okay, all right.
One of the most famous dermatologists in the world.
Yeah,
Many lectures for many products and many exhibitions in the world. You are operating in clinics in the UK, as we can see, and also in Spain. Dr. Felipe started using Lenista also 2 years ago. So he has been richly experienced in PDLLA, especially in Lenista. And Dr. Felipe is going to show us how to reconstitute Lenista and how to inject Lenista for facial and body augmentation. So the floor is yours.
Thank you very much. Right, let me see if I can share the screen now. No, I think that you have to let me
There is a green button.
but when I press it, I can't share it because I can only share you, right? But I don't know why. No, let me see. Is it because I am just a guest and I'm not, I can't share it. So it's usually because I have to be like a speaker as well or a presenter.
Let's try to manage this problem.
Okay, can you, because you are presenting and everything, so share, no. Okay, let me see if I can share now. Good, yes, now I can. Perfect.
Okay, yes.
Done. Fantastic. All right. So thank you very much for my invitation. I've been working with Lenisna for 2 years now, but I've been working previously with L-Lactic since 2003. How many years is that, Bartik? That's 18 years, right? And I was quite interested to know about Lenisna and how it worked because of our long experience with Sculptra and the previous L-Lactic. So let me go through this subject now. So as we all know, there is a tremendous loss of volume as we get old, and that is particularly important in some areas of the face more than others. And we know that these zygomatic areas, some areas here around the mouth, lose a lot of not only collagen, but also a lot of fat tissue and connective tissue. The problem usually stands because we have always tried to do rejuvenation with filling rather than with recovering elasticity. This means that most of the approaches in the past years have been to recover volume, recover volume, recover volume, and it's not always about this. So here you see a famous actor, and you can see that he has basically lost the elasticity of the skin. So it's not about recovering the volume. It is recovering the volume with something that provides with elasticity. And that can only be obtained with collagen. And this is very important. Collagen is a very strange molecule, a very strange protein in nature, because it can link one part to another of the tissue and can bring all these tissues together because of its elasticity. We don't have proteins like this in nature. So we know that there is a reduction of dermocollagen. This dermocollagen accounts for 90% of our 2 most superficial millimeters. We also know that there is a reduction in the fat compartments of the face, except 2, right? And there is a tremendous loss of tensile strength of the ligaments. When people discuss about rejuvenation or aging, they say, well, we've lost volume, and usually plastic surgeons would say, we have lost the tensile strength of our ligaments. So for the first group, it would all be about injecting and recovering volume. But for the second group, which are the surgeons, everything would be about doing surgery and lifting everything surgically. I don't think that one or the other is completely right. I think there's a mixture of this. So let's see what L-Lactic acid can do. The first time that L-Lactic acid was used to rejuvenate was when it was used for HIV lipoatrophy. So this is a historical case, which is very interesting, actually. L-Lactic acid has been used as a suture. And many other specialists have been using it until 1999, when it was formulated and approved in Europe as an intradermal injectable implant, which was called New-Fill. So again, we realize and we discover that what doctors were thinking about was filling, not regeneration of collagen. That's why the name is Neufil. So when doctors started using Neufil, they thought it was a filler, and they would produce enormous problems. So that is why many of the doctors still today in Europe think that Neufil induces nodules and granulomas, which is not true. It is not a filler. It cannot be used as a filler. So in 2004, the FDA approved the use of polylactic acid with a very specific indication, which was lipoatrophy, which is very strange. It's a very typical phenomenon of HIV patients. They don't need to have AIDS, it's just HIV. We don't know why they lose this fat compartment. So the first to publish about this were the French, right? This on the left is stage 1, lipoatrophy, and on the right side here you have stage 2. Here is stage 3 and stage 4. And as you can see, there is this strange lipoatrophy that only occurs with HIV patients. We don't know why. And French doctors started injecting polylactic to recover the volume there. So obviously the results were amazing, were fantastic, with a great percentage of improvement. And what is most interesting of all is that if you measure exactly what happened, right, was that they mixed the product in about 4 to 5 milliliters. So that is why Bartek has told you all that I'm going to deal about reconstitution, because I think it's very interesting how we reconstitute this product completely in a different way today. So this is what they found, okay? They wanted to measure how much volume they would be able to recover. And here you can see, right, in circles, this is immediately after injection of Neufil. And in triangles, Neufil injection delayed by 12 weeks. What happened 12 weeks later? And you saw, well, you see here that there is a recovery of the thickness, right? Mean change of measurements from baseline, right here, of the thickness of the skin. And here in triangle, you see what happened after 12 weeks. So after 24 weeks, that is half a year, what we see is that the volume induced is much higher than the volume injected immediately. This means that in this period of 3, 4, 5, 6 months, we synthesize new collagen, okay? So we're not filled by the product, we are making the filler. So this is probably the first time that in the history of aesthetic medicine, we realize that it is not the product, it is not the filler, the silicone, the whatever that fills in. It is something that we produce. So it's really natural, and it's about the regeneration of our skin. So obviously, this continued later and later. And of course, the product was used in HIV patients, and we can perfectly measure the improvement of the thickness of the skin, right? So this product was injected in the fat layer, which is 3-4 millimeters deep, right? But these measurements tell us about what's been changing in the surface of the skin. So this is the really interesting thing. 6 weeks, 24 weeks, 1 year, 2 years later, there is an improvement of 43% of the thickness of the skin. So what this is telling us is that even though we were trying to fill something, we discovered that what we were doing was regenerating the skin. So these patients, let me go fast, what probably were doing was reacting in an inflammatory way against the product, but they were building up a new dermal tissue. So it is difficult to understand for us how an inflammation can transform or can become a construction of new connective tissue, because we know that inflammation usually destroys the tissue. But in this case, the inflammation meant that we were slowly bringing a special subtype of macrophages called M2 that were stimulating the deposition of new collagen. So things evolved, right? We have in 2004 Sculptra, and we have years later Linisna, which is a mixture between levo and dextro lactic acid. So what is Linisna, right? And, how do we explain to our patients what Linisna is, right? So it is a mixture of hyaluronic acid together with polylactic acid, or a mixture of polylactic and polydine. Also, the particles are a bit different. They range from 10 to 100 microns. So they are big enough not to be swollen by cells, but they're not as big as to cause any problems. So when we have to explain to people what is the difference, right? Usually we start with Sculptra because it's the referral first product that we started working with. So Sculptra has got polylactic, and it has a little bit of mannitol that is a very good hygroscopic substance, so it brings in some water. Whereas with Linisna, what we bring in is hyaluronic acid. There is also a difference between polylactic acid and in Sculptra and in Linisna, because in Sculptra, what we have is the PLLA, meaning it's the polylevo, which is usually crystallizes very well, whereas the PDLL, which is the formula for Linisna, is amorphous. It doesn't really crystallize. So the difference clearly is that Linisna contains a little more of polylactic in comparison to Sculptra. And Linisna particles average 38 microns. They're a little bit smaller in comparison to the small particles of Sculptra, which are a little bit bigger and larger. So this change in the size of the particles and in the composition helps in the suspension, which is usually important, because once we have to inject, we find it difficult to use Sculptra, those that have injected a lot. This is what happens when we inject something. This is not polylactic. I think that you all know, if you know something about pathology, which you do, we all know that this is hyaluronic acid. It is an amorphous gel. It is blue because it's acid, and it kind of it's quite big. But we see that around the particles, we see a lot of new cells, especially fibroblasts, that are activated, and they produce new collagen. You see this stain, this strong stain around the particles, meaning that we are synthesizing collagen. So every time we use a filler, every single time, we stimulate our dermis in order to produce new collagen. So the funny thing of this biopsy is that we take into account that the epidermis, which is here, is about 0.2 millimeters. This means that this is less than 1 millimeter. So my question to you, how many of you inject hyaluronic acid in the first millimeter? No one, right? Usually we use basically half the length of the needle, which is about 6 to 7 millimeters. We use the whole length of the needle, which means that when we inject hyaluronic acid or any filler, it is deposited much deeper. It's not really in the dermis. So what we are seeing here is just an experiment. It doesn't really happen in real life. So probably this is a rat model or something. In fact, it is, where they tested different substances. So the capacity of synthesizing new collagen will depend where you inject your product. Let me go further, right? This is polylactic, right? And this is a comparison between PDO materials, right? You see here that always around any material that we inject, there will be a synthesis of new collagen, especially because there is a small degree of inflammation. So here you have polylactic acid. This is not Linisna, this is polylactic. And you see that particles are quite big, so they form multinuclear cells around with a little bit of inflammation. Here you see one, right, trying to engulf these big particles, and with this reaction, they produce new collagen. What's the difference between calcium hydroxyapatite? Well, most of my friends would say that calcium hydroxyapatite, or Radius, is a very good stimulator of collagen, right? This material is biocompatible. The size of the particles are very similar, and it's a great inductor of collagen. But if you read carefully in the literature, you see that calcium hydroxyapatite gives problems all the time. For example, a randomized split phase isomorphologic study comparing a volumetric calcium hydroxyapatite. And you see here, right, at month 4, collagen type 3 was greater with calcium hydroxyapatite, right? But then you see actually who writes this, right? And you see that the same author is always writing about calcium hydroxyapatite. And I was researching where she was working. She was always a consultant of the same pharmaceutical company, which means that the studies that these authors publish are basically paid and financed by the same pharmaceutical company that sells calcium hydroxyapatite. So all the things they're going to read are good, obviously. But when you go on and on, right, you usually discover different problems like this one, for example, nodule formation after calcium hydroxyapatite. Or for example, this one, calcium hydroxyapatite deposition disease. There are problems when you inject calcium. It's not really absorbable. So usually this is asymptomatic, but it can cause many problems. So don't think that some things are just stimulating, they're not causing problems. For example, here, a novel solution for superficially placed calcium hydroxyapatite in the inferior eyelid. What is this novel? Does it mean that there were old solutions? Yes. In fact, because calcium hydroxyapatite produced many problems, and there have been many solutions proposed to these problems. So I think that we have to look, we have to search for a product that induces collagen but doesn't produce so many problems. So, which is the most correct way to inject polylactic now that we know all these many things? So usually they would in different books, they would recommend us to inject in bolus, right? But this would be against the reality, against the natural effect of what we produce. So imagine that I'm injecting a certain amount of volume in just one place. That's this upper big balloon here, right? The surface in contact with the dermis is that, right? 4πr cubed 1/3. If we split that into 1/3, we multiply the surface in contact by 27. So this means that by just injecting smaller amounts or spreading a product, we will be able to contact the dermis and to stimulate collagen much more efficiently. So it's not about injecting everything in one place. It is about spreading, and making our product interact. It not only affects the volume you are synthesizing, it also affects the number of patients that will have problems if they have. So how is the product prepared? If we want to spread the product, this is how they did it in the past. They mix it with 3, 4, 5 milliliters, right? But today, right, because we know that this has a very high incidence in the past of 31 to 50% incidence of papules of nodules, right? Today, we dissolve it in a different way. So this is the way I do it. In the label, it says dissolve this in 5 milliliters of distilled water at least 2 hours before the treatment, okay? Sometimes patients don't come, or sometimes a patient comes and wants to have a treatment that same day. If we haven't prepared anything before, what we should do is to prepare something the previous day and to have some bottles ready for injection. This is a video where I explain everything. Because it's in Spanish, I will translate this. So what we do here, we just reduce the volume, okay? So what we used to do, right, was, okay, we injected, we put in 5 milliliters of of distilled water, and we waited till the following day. But today, what we do is a different thing. We inject the 5 milliliters, we wait, and the following day, we add some milliliters of anesthesia. Let's say lidocaine 2%, for example. Okay, so let me see if I can run this video a little faster, right? So I would take the anesthesia like this. I take 2 milliliters, 3, 4, 5. Perfect. I add the anesthesia, 5 milliliters, to the 5 milliliters of distilled water. How much do we have? Well, easy. 5 plus 5 is 10. All right. So here we have 10 milliliters with a mixture of distilled water, anesthesia. I shake it and shake it. And then what I do with this 10 is, instead of injecting them directly, I mix it with more sea lime in this way. So in the same syringe, which is 10 ml, I would get 3 milliliters, 1, 2, and 3. And the rest of the syringe will be filled in with sea lime. This means that I will get a mixture of 10 milliliters, of which the 3 ml were already inside the vial. It means that I can use one full vial and mix it in a total of 30 milliliters that I can inject anywhere. So what I have here, let's see, let me just undergo this again, right? It's adding 5 milliliter to one vial, then add 2 milliliters of lidocaine, 3, 4, 5, right? Mix it in a total of 5, so we have 10, and then obtain 4 milliliters of 3 of the mixture, so then we have a total of 30 milliliters. So I have a very, very, very much diluted product. So how much time does the product last once diluted? It can last weeks, months. I've tried it in different ways. A week later, a day later, a month later, it doesn't have any effect at all. So why do we have to mix it in distilled water first rather than sea lime? I don't really have the answer. I just follow the indications, but the problem is that when you inject distilled water in the body, it is really, really painful. So that's why I said, well, if the body is 0.9, why should I inject something that is 0? Okay, let's mix it, because in the end, my product is going to end up in an environment, which is the skin, where the concentration, the osmolarity is going to be 0.9. Okay, if something doesn't, if you don't have any product ready, you can reconstitute it immediately before. That is something that we don't do because we already have products prepared. But if you need to do it, it has been published at least that you can mix polylactic just immediately before the treatment. So how much do we inject? Okay, this is a patient, right? After one session of 1 vial of Levisna, I have diluted it in 30 milliliters and I have injected it through a cannula. This is a man aged 53 years old, the same as me today. And this is the same man 1 year later after 5 sessions. And we follow the rule of decades. For every 10 years of age, you inject 1 vial. If you're 43 years old, you inject 4 vials. If you're 53 years old, you inject 5 vials. And this is the effect a year later. This is the procedure, all right, and how we do it. Because the idea is not to inject here or there, but spread it all over the skin. We inject a little bit from there, that's a perfect entry point from the lateral side, the zygomatic arch. And here I go with my cannula. As you see, it is not a very bloody procedure. We can't even see where the blood comes in. So we find our way in, here we are, and we go inside and we start spreading the product as if it was news. This is the good news, that it's going to to find its root and create new collagen. So here we inject it in different directions and spread it all over these areas that we know that find atrophy as they age. The zygomatic area is a crucial area, but also the upper eyelid and the size of the forehead and the temples. So here I go and I turn from one side to another. Sometimes difficult to anesthetize patients completely, and even the cannula sometimes bend from one place to another. But it's not a very long procedure. It takes some minutes, and you spread the product everywhere in order to improve the chances of everywhere to synthesize new collagen. So what I have used here is 1/3 of my vial. Here I would be using another 1/3 of the vial. And finally, in the lower part of the face, I would inject the other 1/3, 1/6 on one side, 1/6 on the other side. Let me see if I can show to you how I do this around the mouth. And then let's go quickly through the clinical cases. You see how I inject from that point, which is 1 or 2 centimeters lateral to the mouth commissure. You can even go underneath the chin. This is a very interesting area. People tend to ask me, how can I remove the fat? And I tend to say to them, it's not about removing, it's about synthesizing more collagen just underneath the face. Because otherwise this will hang down. From here, we can also treat all the jawline, which always loses collagen and falls down. You see how I'm going just underneath the chin. This is very important. You see one side, the other. This is just the effect of the liquid. But once our Lenisna produces new collagen, it will look very nice. So again, Lenisna is suspended in 5 milliliters. You add the lidocaine and you dilute it. You dilute it. It's not really important whether you put 60, 30, 20, 50. It is about dilution. So this is a patient after 1 session. This is immediately afterwards. And as you can see, there is no bruising. There is no swelling. The product is fantastic. All right. This is another patient immediately afterwards. All right. And here you see a year later, after 3 sessions, and you see this smoothening in all the areas of the face, because what we are doing is synthesizing collagen everywhere so that everything gets tightened. This is another patient with 5 sessions. She's 62 years old. Or here you have another patient, 51 years old, immediately after. And this is after 2 years with 3 sessions. And there is a smoothening of all these wrinkles and folds. For example, you have here another patient after 5 sessions, 2 years later. There is even an improvement in the quality of the skin. And for example, here, 2 years later, you see the result is amazing, especially around the mouth. And for example, here, after 4 sessions, 2 years later. The forehead is a very interesting area as well, because there are no treatments for the forehead. It's usually very painful. What do we inject? No one injects anything in the forehead. So this is what we usually do in the forehead. We would find a place up there, right? And from here, we would inject underneath. You can put a little bit of topical anesthesia, or you can inject the anesthesia on top. So it's very important to create long channels with your deposit, with your dilution of Lenisna. And from here, we'll see now, right? You create new volume and you create new bundles of collagen that will bring everything upwards. Because traditionally, nothing is injected there except some hyaluronic acid. There are very few publications about this. So in this technique, right, as we inject, you will see that there is a movement, there is the eyebrows will rise up. And you do a massage there. This is the other side. And as you can see here, you put a little bit of anesthesia there, right? And from here, right, you would go with your cannula. This is a 25 gauge cannula. And you make these threads. And as you do that, you're going to see that the eyebrow is lifted a little bit, because gaining volume in the upper forehead is very, very important. All right, this is an example. 41 years old, 4 sessions of 4 vials of Lenizna, 1 vial each time. And the treatment was done in the forehead with this pasta technique and in the face. And these are the results. Amazing. Also in the body, we use the same dilutions in the body. This is a patient after 2 sessions of 1 vial. It seems that we don't need as many vials as we do in the face, right? Here you see another one with an improvement of those wrinkling areas you see here, right? So there's a lot to say about the mechanism of action, but I think that we don't have time for this. But basically, what we know today, right, is that we are creating new collagen through the inflammatory response, right? This is all the fibroblasts producing new collagen in green, right? And obviously there is a strong synthesis of new collagen, both type 1 and type 3. Type 3 appears at the beginning, type 1 later on, right? So let me just skip this, okay, right. So in summary, polylactic acid and Lenizna has brought new indications for us because we're treating the buttocks, the body, the chest, the arms, the hands, the forehead, and areas that we would never have imagined. It's not about filling, it's about regeneration. And sometimes we even compare it with a nanofat or with stem cell therapy or with other therapies because it's all about regeneration today. I haven't detected any nodules or problems with the use of Lenizna. I don't know whether it's the dilution that we use, but I'm surprised with you, Bartek, you found 0.31%. That's a very, very, very low incidence of adverse effects. And the improvement that you find is very gradual, very natural, and very compatible with the medicine that we want to practice today. Thank you very much for your time.
Thank you very much, Ingo. It was great, as usual, a great lecture. There is only one question, as I understand, because I don't know Spanish. Is there any upper age limitation about Lenizna?
Well, I haven't mentioned this, but I suspect that the younger you are, the better the response is. This is what I see. So when you do this in patients over the age of 70, it is not very effective. And that might be because most fibroblasts at that age are collapsed. You're not going to find all that much effect at that time. But obviously we do that there. But probably the perfect age is 40, from 40 to 60. Well, if I just had one question, and the way to measure the quality of my presentation, according to Bartek, is by the number of questions. I mean, the less questions, the better your quality. I think that I'm very happy, right? It means that my lecture was good quality, wasn't it?
Yes, of course, it was perfect. Thank you very much.
Thank you.
Now it's time to present Dr. Suk Seo from Korea. Dr. Started using Juveluga Lenizna as soon as they were launched. He has tried to use Juveluga Lenizna for diverse cases with several delivery methods. And recently, he's trying to expand the application of Juveluga to combine it with plastic surgery cases. And Dr. Seo will talk about his ongoing clinical trial regarding the comparison of the capability of collagen generation of various skin boosters. I am personally looking forward to the results. And he will show some cases of unique indications with Juveluga Lenizna. Dr. Seo, the floor is yours.
Hello, can you see?
Yes, of course.
Okay. Is it working?
Yes, of course, we can see everything perfectly. Thank you.
Okay. Okay, good. Hello, everybody. Please don't go outside. I will show some resolving complication. I will show the secret method today. I will open. Hello, I'm Dr. Joseph Seokbae from Seoasong Dermatology Clinic in Seoul, South Korea. I have been working as a dermatologist for 25 years. It is great to see you all. Thank you for having me. Welcome to PDLA lecture. Today, I will talk about ECM regeneration and mesenchymal stem cell differentiation by using Juberuk and Lenisna. It is very happy to use this material. It is very popular in Korea. This is my current career in the dermatology field. I'm a key advising doctor to Biome Global. We already know that PDLA comes in two forms in the market. At first time, one product was made, but I recommend to separate size by size. So two product was made. So company make a lot of money. And okay, this image show old scar that was treated with several microliter Lenisna. This is the result 4 weeks after treatment. I see. A 25-year-old appendectomy scar had a significant improvement after a single treatment in terms of its volume and color. Let's see. Working, please. Not working. This is a recent result. It shows amazing result after Lenisna microliter injection. This is a picture of same scar 3 months after treatment, and it shows marked improvement. You can see amazing result 8 months after one treatment. This is the same picture. In order to study the mechanism behind the clinical effects of PDLA, we conducted in vitro and in vivo experiment using PDLA and compared it to other collagen stimulators. The experiment were conducted in partnership with the Department of Anatomy and Cell Biology and Gachon University College of Medicine by Professor Kyung-hee Byun. The company was not involved in the study. It was a double-blind study using PDLA and other collagen stimulators. Other collagen stimulators used include common substances such as HA filler and etc. Number 7, Juberuk, dilution 4 cc. Number 8 is Lenisna, dilution 8 cc. In part 1, I will discuss the result of the in vitro experiment. In the in vitro experiment, human adipose-derived mesenchymal stem cells were used. We observed various growth factor and fibroblast precursor after 48 hours. After 72 hours, we observed the papillodermal fibroblast and reticulodermal fibroblast growth. 120 microliter each substance were used in 3 cc of culture media. In the detection of growth factors, basic fibroblast growth factor had the highest increase for Lenisna according to mRNA level. Other growth factors didn't show prominent difference from stem cells. In terms of growth factor, Lenisna number 8 had a great and other a few other substances show increased TGF 1, 2, 3. Juberuk didn't show TGF expression, perhaps due to the small amount was used in the culture media. For fibrous differentiation from stem cell, number 3, number 4 also showed a positive effect, but Lenisna, number 8, showed an even and significant increase in markers of dermal fibroblast precursor, papillary dermal fibroblast precursor, reticular dermal fibroblast, papillary dermal fibroblast. In summary, Lenisna showed an increase of growth factor and fibroblast growth and differentiation from stem cells. Juberu didn't have a positive result due to the low concentration used. We need to control the concentration. In part 2, I will discuss the result of animal study. This part is more important for understanding of tissue regeneration. We injected 100 microliter of substances in 5 areas in 12 months old mice to compare 8 substances. A 12 months old mice is equivalent to a 50-year-old person. It is very, very difficult to regenerate the skin. We observed how regeneration occurs and how it is compared in these old mice. We collected the sample 8 weeks after intradermal injection. Using same method, we sampled the substance 7 and 8, Juberuk and Lenisna, on weeks 2, 4, 8, and 12. These are the sample 2 months after injection. Solid substance were observed in number 1, 2, 3, 7, and 8. Number 4, 5, 6 had complete dissolution and have no visible substances. But Juberu finally disappeared after 12 weeks. It showed that Juberu can be dissolved more easily than Lenisna. We look at the basement membrane zone on the 8-week sample using PAS staining. Number 7 and 8 show increased staining. These findings are very unique, especially after injection of material. Other materials didn't show this effect. When compared to HA injected sample, the difference is more visible. 7 has more staining. When quantified, number 7 and 8 had a significant increase compared to others. When observing 7 and 8 specifically, number 8 had increased BMZ PAS staining from week 4. At week 12, mice significantly aged and thus have decreased staining. This is a graph serial checking PAS staining change for number 7 and 8. 7 has a strong increase at week 8, and number 8 has increase week 4 and 8. This is a Marsan trichrome stainings. Number 2, number 5 show slight increase in staining, but the picture shows a marked increase in collagen fiber for number 7. When quantified, number 7 has a significant increase in staining more than other substances. When compared to HA injected sample, 7 has a great increase in staining as there is a more collagen regeneration. When observed up to week 12, number 7 shows increased staining until week 8, but week 12, staining fade due to the age of the mice. When serial checking with the collagen increase peak at week 8 for number 7 and is maintained up to week 12. We also observed the change in elastic fiber at 8 weeks. Again, number 7 shows an increase in elastic fiber using bare staining. Elastic fiber is usually difficult to regenerate in old mice. So this finding is very unique. When compared to HA injected sample, 7 shows a much larger increase in elastic fiber. Computer quantification shows a significant increase in number 7 compared to other substances. This finding showed a long-lasting, strong effect of number 7 to make elastic fiber. When observing number 7 specifically, once again, we see an increase in elastic fiber up to week 12. The serial checking figure show how even in old mice, 7 show gradual increase in elastic fiber growth. This is very, very special findings. In terms of tropoelastin and elastin binding protein, 7 show an increase in both as well. We can see from serial checking that tropoelastin and elastic binding protein has a great increase at week 4 in number 7. This finding that show that number 7 is closely connected with elastic fiber reproduction. This slide stained use Horvitz staining to show different types of collagen. Old collagen is shown yellow, type 3 collagen is blue, and type 1 collagen is red. Number 7 show increase in type 1 and type 3 collagen, so a strong purple color is made. When compared to HA injected sample, the increase is more apparent in blue and red color in 7. Computer quantification shows an increase in staining for 7 after week 8. Increase in type 3 collagen, blue is shown in week 8 up to week 12 for number 7. This same result showing an increase up to week 8 and 12 for number 7. And MMPs were checked for fiber degradation. After 8 weeks, MMP 1, 2, 3 were decreased prominently for number 7. This showed the protection function from fiber degradation of number 7. In terms of fiber degradation change, MMP 9 decrease is also observed in number 7. We found something important when serial checking MMPs. When number 7 and number 8 were looked at over the weeks, number 8 had an increase of MMP 1 and 13 during the early weeks. We presume that this is the reason why number 8 had less positive effect in animal testing. In the experiment, we expect that number 8 would show the best effect in terms of regeneration, but the bigger particle could trigger a strong immune response and inhibit regeneration at early stage. We can expect that high concentration is not always good for regeneration. So I agree with Dr. Inigo Di Filippe. He used a very thin solution. This is fast stem cell marker detection findings. Stem cells can induce the secretion of various growth factors and differentiate into the fibroblast to produce ECM. Therefore, we identify the change in expression of fat-derived stem cells, CD34, CD44, and CD9 to evaluate the changes in fat-derived stem cells after 4 weeks of substance injection. CD34, CD44, CD9 are well-known fat-derived stem cell markers. After injection of number 7, stem cell markers increase significantly, not only in control, but also in comparison with other substances. We assume that this effect can lead to the release of various cytokines and exosomes that are very favorable for skin regeneration. These are fibroblast marker findings. Fibroblast, which produce ECM, is a cell differentiated from stem cell. Stem cells are differentiated into dermal fibroblast precursor, papillodermal fibroblast precursor, and reticular and hypodermal fibroblast precursor, and then finally differentiate to the fibroblast. Markers of cells in each stage, such as LRIG1, BLIMP1, DLK1, FFS1 are well known. After injection of number 7, each stage cell markers increase not only in control, but also in comparison with the other substances. Papillodermal fibroblast increased, reduced scar response, and show the possibility of improving scar texture. In terms of fibroblast differentiation change, Juberuk showed a markedly accelerated in differentiation step of fibroblast. In terms of change of 8 weeks after substance injection, number 7 again had the best result as checked by moisturized analyzing machine. Elasticity rate change also show best when comparing 7 and 8, as 8 has constantly increasing moisture change. Similar result can be observed elasticity when 7 has a constantly increasing elasticity. This is a human skin mesenteric staining image before and after PDRA injection. This is Juberuk. Image B is 6 months after PDRA injection and shows the increase in ECM material compared to image A. Important finding is the increase of ground substance between fibrotic component. This is beneficial for solving whitish fibrotic scars. This is histologic finding after intradermal injection PDRA. Light picture demonstrated increase of elastic fiber after 6 months. And in this image, you can see an increase in elastic fiber in the papillary dermis after 6 months. This slide of human skin 2 months after several microliters of Juberuk were injected using high-speed needleless micro injector. The slide shows an overall increase in collagen in papillary dermis and reticular dermis. This shows the upper dermis is a magnified version of previous slide, much increased. Again, this image showed an increase in elastic fiber in the middle and lower dermis 2 months after treatment of Juberuk. This zoom in of the findings show prominent elastic fiber increase. In summary, hydration, elasticity, basement membrane regeneration, collagen fiber regeneration, fiber degradation inhibition, elastic fiber synthesis activation, papillodermal fibrosis increase. Number 7 show the best effect in all aspects, but number 8 need a concentration adjustment. Recently, researcher report some wonderful result to me. Real fibroblast, real stem cell regeneration and recruitment, differentiation, proliferation was detected in the tissue level and cell level. So the new article will be released soon. You can see that. I will talk about several drug delivery tool. You are familiar with the needle and cannula, so I explain another tool. Automatic multi-needle, needle RF, needleless injector. And, this is automatic multi-needle is used a lot for rejuvenation. In order to inject Juberuk very delicately and densely, you can use an automatic injector. This is adjust to shallow depths, which cause less pain. For periorbital area, please use a very small amount, and very thin needle is needed. I frequently use this technique of high lead area. Now I will introduce to Mirajet. This is device system that expel drug high speed, high pressure, can be used for scar treatment, skin rejuvenation with Juberuk or Lenixna. This video shows the treatment method PDRA delivery using Mirajet. Mirajet effectively and rapidly deliver PDRA, Lenixna, and Juberuk. Mirajet, this is a soft technique. Without bleeding, we can deliver a PDRA particle very delicately. I frequently use this method all day long. This is device, apply strong positive pressure, apply the pressure after needle is removed is a good technique for acne scar treatment. This is it's the most commonly used method for drug and energy delivery when I treat acne scars. Stacking is very important. Recently developed pumping tip to increase the sharpness and thickness of needle. So this tip further improve the delivery of drugs. A new pumping tip is designed to increase air pocket and be used not only monopolar but also in bipolar mode, increase the therapeutic effect. PDLA are injected directly into the scar to induce ECM, and pumping tip makes the drug delivery and thermal coagulation. I frequently combine this technique, injection first and then drug delivery at the same time. This finding is very important. In addition, PDLA can be applied clinically in various ways using this property because glass transition temperature dropped to 40 degrees from 50 degrees Celsius after hydration. This finding is very important. Juberg Renisna molecular weight is 136, this area. So we can soften and spread well and promote particle breakdown by increasing tissue temperature. This is approachable temperature. This is a final slide. Uninformed beginner doctor accidentally inject a high concentration Lenisna into the intradermal layer. How can you handle? How can you handle? How about Dr. Bartek? Could you
Yes.
reply?
I use also, I haven't mentioned this in my presentation, but I also use radio frequency microneedle. I've got Morpheus 8 from Israel, from mode. But usually I start with injections because those nodules are usually just the high concentration deposits of polylactic acid. And if you inject even normal saline, you can distribute more evenly the substance, so you can decrease those nodules without no harm using only normal saline. But of course, radio frequency microneedling is very effective.
Yes, right. And I will show the answer. And this is one-time treatment. Needle RF and RF thermal heating, 40 degrees Celsius. But important finding is important technique is a strong compression after heating. Simple heating can control the nodule. Do you understand? Because this after heating, this material is the glass transition temperature is changed to very low.
You can message it.
Strong message, strong compression.
Not only heating, but also message is very important in this case.
But the heating is also important. At first time, you use the heating
to lower the glass
and the compression.
Melt it slightly. To make it more plastic.
Because already hydrated, already deeply hydrated. So glass transition temperature is changed to very low level.
Degrees from 52, as far as I remember. Yes.
That you can control every complication very easily, but this changing of compression does not solving
properties of the
completely disappearing. There's some.
It's incredible. Great information. Thank you.
That's my finishing. I thank you for all attention and thank you very much. I didn't check. I didn't check.
There is one very interesting question. How did you quantify the degree of staining for example, elastic fibers? Is there any image analysis? If so, what software did you use?
This procedure was done by university. So special program was regional special program was used, and they didn't involve in some benefit. So
Okay.
they are regionally calibrated.
Digital, analysis
Digital
of-
imager, digital imager.
Okay.
Some block
Okay.
was choiced and finally analyzed by computer.
By computer. Okay, thank you very much. It was a really great amount of new knowledge. I'm
Yeah.
very impressed. Thank you very much.
Yeah.
It was
And
very important.
this is
and
a
the
very
last one,
basic.
very also very positive information is that there is a straight connection between those observations we have that this
Yeah, right.
Juvaluk is very effective in clinical
Yeah.
everyday practice.
Yeah.
And your findings are really perfect because they match completely,
Yeah,
and
right.
they convince us to use Juvaluk, because I think also that this is one of the best products in the world right now.
Yeah, right. Actually is a PDLA, especially Juvaluk is not a simple collagen stimulator. That is
No. Yes,
yeah,
it's
it's a
more
stem cell stimulator.
effect.
Yeah.
Yes.
You can see the new article soon.
It would be a pleasure to read it. Thank you very much.
Thank you. Thank you.
All right. Hello, world again. This is the end of our lectures. I think that it was an unforgettable experience to listen to all those magnificent lecturers today. Really, thank you, all of you, for great speeches. It was a great pleasure to listen to all this amount of knowledge from all over the world. Great thanks to the audience. Thank you, your dear colleagues from all over the world, for your presence and for interesting questions to all our lectures. I hope all of you benefited from this conference and get inspiration to develop your everyday practice. And I'm also convinced that those lectures dispelled any doubts and convince you all about the safety. It's the most important thing, I think, in our everyday clinical practice, to do the safety procedures and the effectiveness of poly-D-lactic acid products, Lenista, and especially my beloved one, Juvaluk. So thank you, every lecturers again. Thank you, Beauty Europe. Thank you, VIAM Global, for Julia 2022. And I think that we see soon on 2nd Juvaluk and Lenista International Academy.
In Korea, we will. There are so many experts, so they are waiting. They are about to share the experience.
And there is also an interesting question: when using needleless injector, do we lose some of the medicine?
Yeah, right. Yes, but yes, direct injection is also important, but it's the separation function is also combined. So
yes,
if you use the Lenista in the directly injected in some area, especially dermal area, you must separate it. So this needle is needed. Needling is needed, and
yes, first needle and then needless injector.
Yeah,
to both of them all together. Okay, so I think that we are done. Thank you very much.
Thank you very much. Thank you. Have a wonderful weekend.
Yes, have a nice weekend to all of you.
Yeah. Someday I want to meet you. See you.
Thank you.
Thank you.